And the definition for a close contact is as follows, very similar to what I said to you yesterday. Except in exceptional circumstances, a close contact is a household contact or household-like of a confirmed case only. A household contact is someone who lives with a case or has spent more than 4 hours with them in a house, accommodation or care facility setting. So you're only a close contact if you are effectively living with someone or been in an accommodation setting with someone more than 4 hours with someone who has actually got COVID. Not someone who was in contact with someone who's had COVID. It's with someone specifically who has COVID. Now, a confirmed case would isolate for 7 days from the date. So someone who actually has COVID, from the date that they took the test, they would have to isolate for 7 days and have a negative RAT test, a rapid antigen test, on day 6 prior to being able to leave isolation after 7 days. A close contact that is symptomatic must have a PCR test still. So if you're symptomatic, and that goes for anyone who is symptomatic, by the way, if you're symptomatic, then the right test is a PCR test. A close contact who is asymptomatic, doesn't have symptoms, must have a rapid antigen test, and if positive, they must then have a PCR test. And in that case, they become a confirmed case, and the rules that apply to confirmed cases apply to them. Now, close contacts that return a negative test, they must remain isolated for those 7 days because symptoms and other things can present later. And that is 7 days from their date of exposure to the person who is a confirmed case. And they also will have a rapid antigen test on day 6. So, to summarise, if you are a confirmed case, 7 days, on the 6th day, you have a rapid antigen test, and if that's positive after 7 days, you can go back into the community. If you're a close contact, you get a rapid antigen test. If that returns a negative, you still remain in isolation for those 7 days, and you have a rapid antigen test again on day 6. If you're a close contact and you're symptomatic, go and get a PCR test. If you're a close contact that returns a positive RAT test, go and get a PCR test. Now, what this does is significantly changes those who need to be going and getting in queues. Now, particularly because this comes into effect at midnight tonight in 5 states and territories, if you don't fulfil this definition of a close contact, then there is no need for you to be in that line. You should go home. Go to the beach. Go and do what you want to do. Read a book in the park. Follow all the normal common sense things that you would do. Monitor your symptoms. Follow the COVID safe practices. Make sure you've booked in for your booster. Do all of those sorts of things. But there's no need for you to be in that line. The people we need in that line are people who need a PCR test. Now, we will transfer over the next few weeks from PCR to these rapid antigen tests at the state testing centres over the next couple of weeks. Larger states will be moving to get those rapid antigen tests to those testing centres as soon as they can, and that will happen over the next few days and next few weeks. So if you turn up at those testing centres for all the reasons that I've set out, then you will either get a rapid antigen test or a PCR test. If you're eligible for a rapid antigen test and there's ones there at that time, you'll be given one of those, you'll go home, you'll take it and follow those rules. If there isn't a rapid antigen test there, then we will still give you a PCR test in the transition. Now, if everyone else who doesn't need to be there gets out of the line, then that means we can get to those who need to have those PCR tests as quickly as possible. This should significantly, we hope, over the next few weeks, greatly reduce the volume of people who are having these PCR tests, which means we'll be able to increase the turnaround time of these tests getting the results back to those who need to take them. In addition to that, it will also free up, we hope, a lot more workforce that is currently being focused on these tests to be able to be supporting the other priorities for managing the pandemic, in particular the boosting clinics and centres for administering the vaccines. Those who don't need, if you're anything other than a close contact, and you're not symptomatic, you don't need to go and get a test. Now, I know this is a bit different to what you've been hearing over the last couple of years. That's the gear change. That's the reset. That's what we need people to really understand. And I know it's a change from what has been said, but dealing with Delta is very different to dealing with Omicron. And to ensure that our public health systems work as effectively to keep as many people safe as possible, that's why we need to make this change. So you don't have to go and get a rapid antigen test if you just happen to walk past or go in and get takeaway or even be at a restaurant or a pub. You still need to check in because you want to monitor your systems. Anyone else who would like to get a rapid antigen test, well, you go along to your pharmacy or to the supermarket or the warehouse, big suppliers, where we believe as a result of making this change and being very clear about who is being provided with a public test and who is not, all the private industry who gave us that advice this week, they can go now, they can book their supplies, they can get them on the shelves and not have any concern that somehow a new policy will come in and tests will be handed out to anybody who wants one. It was agreed today that will not be the policy in Australia. Rapid antigen tests will be provided publicly at those testing centres for those who require one according to the rules that I have set down.